Abia State government, led by Governor Alex Chioma Oti, launches formal sector health insurance with Obasanjo Foundation on hearing aid program and free medical outreach. The government of Abia State government, in collaboration with strategic health partners and the Obasanjo Foundation, has officially launched 3 major health initiatives aimed at improving the well-being of Abians. 1. Formal sector health insurance scheme to ensure accessible, affordable health care for workers in public and private sector. 2. Free hearing aid distribution, a project of Obasanjo Foundation targeting residents with hearing issues. 3. Free medical outreach to be fully implemented and executed in Aba and Umuahia, offering consultation, treatment, and minor surgery at no cost to beneficiary. This program was launched on April 10, 2025 at the International Conference Center in Umuahia by 2 p.m. Interested people that want to register can now register now. Don't forget to share this video. Don't forget to share this video. Share this video. Drop a comment and tell us what you think about this video. Don't forget to follow Kasa TV on Facebook and YouTube. Share this video and share this video now. My name is Nwakama Kasmia. Thank you.
Modern have been retrofitted, while others are in different levels of upgrade. New ones are also being built from the scratch, and because we have institutionalized prompt and regular payment of salaries and other entitlements, industrial arrest, which led to endless service disruptions in the years past, have become a distant memory. Our vision for healthcare delivery is to build a system that is dynamic and responsive to the needs of the local population, catering to multiple healthcare needs at affordable costs to the individual and in some cases borne entirely by the government. In the denial, no one will be denied access to health services for reasons of financial incapacity or for any reason at all, because our approach is holistic. Across the 17 LPAs of the state, the government is working on about 300 primary, secondary, and tertiary health facilities. Of course, fixing roads, improving electricity supply and security architecture, and proactively addressing the hazards that made access to health services difficult in the old order. In continuing pursuit of our rapid crash vision for the health sector, we have gathered this afternoon, now evening, to launch a triple barrel initiative that will revolutionize service delivery and access to health care for individuals and families. The formal sector health insurance scheme, which we have just launched, will see tens of thousands of civil servants and their dependents enroll for round-the-clock qualitative health services at designated facilities in every part of the state. This initiative, long overdue, is structured to drastically reduce out-of-pocket expenditure for individuals in formal sector employment, cut down risks and hazards associated with self-medication, and create demand for medical services in all the public healthcare facilities in our urban and rural areas. The launch of the formal sector health insurance scheme in the state will complement this right. We have recorded with the Basic Health Care Provision Fund, which caters to vulnerable groups and individuals by offering basic minimum package of health services to members of our community who need protective, promotive, curative, and rehabilitative health services. The formal health insurance scheme will go beyond the provision of essential medical diagnostics and laboratory services to beneficiaries to offer surgical, orthopedic, pediatric, obstetrics, and gynecology services to be relieved at the tiny fraction of the prevailing market rate. The formal health insurance initiative will ease the financial strain individuals and families pass through, especially in times of emergency, and cut down the incidence of maternal and neonatal mortalities. It will ultimately improve the general quality of living and life expectancy figures in the state through early detection of hidden ailments and timely management of conditions that may lead to untimely deaths. The formal health insurance program in the state has been structured to cause very little financial inconveniences to workers, as the government will be paying the largest share of the insurance premium, while the beneficiaries pay just 50% or less of statutory requirements for the next 6 months. I would like to especially appreciate our team at the Abia State Health Insurance Agency for their effort and commitment in making this project a reality. Our expectation is that employees in the various ministries, departments and agencies and their families will take full advantage of this program to attend to their healthcare needs as fairly provided for in the enabling contract. Register the health facilities near you and endeavor to share your feedback with our people regularly. We do not anticipate a perfect scenario at the early stages, but our promise is that we shall continue to improve the system consistently and with your support build a medical service architecture that every one of us can be proud of. The next initiative that shall also be launched at this ceremony, of course, that has also been launched, is the medical outreach program targeted at the poor and the vulnerable in underserved communities. This particular project is the first of its kind because beyond just the fact that we are taking health and medical services to our people living in far-flung corners of the state at no financial cost to the beneficiaries, this intervention shall happen. In the public health establishment, we have restored to formally announce that the facilities are open and ready to serve individuals with various health needs. This outreach will ultimately abolish at the Honorable Commissioner for Health, Professor N. Obasanjo, rightly noted the era of medical programs and outreaches in open fields, marketplaces, or in community halls. Again, I would like to use this opportunity to reiterate the ban made by the state government on the use of public schools, markets, religious centers, and other unauthorized locations for medical outreach. Those who have been here long enough will remember that sometime last year, a group whose intentions were genuine came to conduct a medical outreach in a community in the state. Unfortunately, 2 people were lost, and it is on the basis of that we banned medical outreaches that happen anywhere outside hospital facilities. Whatever medical outreach that will happen in the state can only take place within the premises of a medical facility and supervised by competent medical professionals. We shall no longer allow any abuse of standard medical safety protocol by individuals and groups, however well intentioned. The third part of our program this afternoon, which also has been launched, is the Sound Intervention Hearing Mission 2025, a project sponsored by the Obasanjo Foundation in partnership with the Abia State Govt. The Sound Intervention Hearing Mission will see the distribution of premium hearing aids and support systems to 1,000 persons with hearing impairment selected from different states and communities in the Southeast region. The beneficiaries have been thoroughly screened and pre-selected in line with the pre-qualification conditions defined by the sponsor and our team of experts to guarantee that the aids are distributed to the intended beneficiaries. This initiative will bring immeasurable relief to our brothers and sisters who have challenges with their auditory organs and effectively improve their environmental awareness and quality of life. Again, this support is coming at no direct financial cost to the beneficiaries. Let me at this point, on behalf of the government and people of Abia State, express our collective gratitude to President Obasanjo CFR for his love for our people and for coming in person to participate in the launch of this life-changing initiative. President Obasanjo's patriotism, even at a very advanced age, continues to inspire and serve as an eternal reminder to all of us that no matter the disappointments and frustrations with the state of affairs in the country, we will never give up on Nigeria and its great promises. A lot of things may not have gone as many of us expected, especially in the light of multiple challenges within the nation and its constituent parts. President Obasanjo's continued engagements in public affairs challenges us to remain optimistic, especially in the face of setbacks. I want to again thank our leader for bringing the Foundation's Health Intervention Initiative to Abia this year, which in my estimation is a great endorsement of the modern development strides this administration has recorded in the last 22 months. A statement seal of approval is not given lightly, and we are pleased as a state to have caught the attention of Chief Olusegun Obasanjo, who not only served this nation with energy of his youth, but continues to make timely and statement interventions without bowing to the vicissitudes of age. We thank the Almighty God for the gift of this great leader and wish him even longer and more fulfilled years. Following the inspiring examples of our former president, we shall continue to strive to do the best for our people, taking decisions that are in the long-term interest of the state, even if they are not immediately popular. We knew long before assuming office that things were in a terrible shape, yet we were frightened to the bones by the level of decay and abuse that we saw as we took over. At any rate, because we came prepared to right the wrongs of the past and create new standards that will forever punish mediocrity in our polity, we had to roll up our sleeves to do whatever was required to deal with what we met on ground. Thank God, some modest positive results are shown. Aba, a city that aptly captured the naked and disastrous wrong of the old order, is quickly regaining its lost glory, with its streets and highways neater than it had ever been in the over 100-year history as an urban destination. Hope is recording and investors are once again believing in the eternal promises of a university that rewards men and women who work hard and keep faith in the validity of their dreams. Women is also seeing a resurgence as we continue to expand the city's infrastructure base while restoring ancient landmarks. What many often forget is that Umuahia is one of Nigeria's earliest urban settlements, planned and structured for rewarding cosmopolitan experience. We shall continue to expand the scope of our public sector investments in the capital so that in no distant time, this city will regain its pride of place as the premier urban destination in the country. Beyond our commitment to establishing inviting urban centers in the state, we are also taking steps to make sure that no one is disadvantaged in any part of the state. Abia, with the recent signing of the state's electricity bill into law, we shall begin to to see unprecedented levels of investments in different layers of the state's energy market. Our negotiation with the state electric for the purchase of this electricity distribution business in the state, and we expect to. The management board of the state's electricity regulatory agency will soon be inaugurated, and with that, the business of generating, transmitting, and distributing electricity for domestic and industrial users in different parts of Abia will move to a new gear. With key components of the electricity value chain firmly in the hands of new players and regulated by a team of world-class energy experts, we expect to see unprecedented business growth, influx of new investments, and the multiplication of opportunity for entrepreneurs, job seekers, and all who share in the vision of a new Abia. As a matter of fact, I sat through 3 days of interviews with different applicants from all over the world. And just over the weekend, we selected 5 of the best who will run the Abia State Electricity Regulatory Agency. Interestingly, 4 of them come from the state, but they don't live here. One of them lives in the UK, the other in Canada, another one in the US. But they are all willing to relocate here because of the community. Distinguished ladies and gentlemen, friends and believers in the new Abia project, I'm glad to assure you that we are on the right track. Today's picture of activities and their projected impact in the health and general living conditions of individuals and families are proof that we did not seek power to serve their interests, but to make a difference in the lives of men and women forgotten by the old order. My promise to you is that we shall remain focused and dedicated to the grand vision and the noble ideals that inspired us to begin the fight for the soul of Abia more than 10 years ago. The credit for the success of the last 22 months belongs to the ordinary men and women who never gave up in the face of multiple institutional frustrations, who believe that workers and retirees should end their entitlements as have you, who refuse to accept insecurity and social uncertainty as the new reality of living, and to all who insisted that because every society is built by the determination and commitment of everyday people, fought to rescue the state from the power that once held it hostage. We must, however, refuse to be misled, for clearly it is not anything good. We are just starting and can only get to our destination by staying vigilant to stave off the distractions that often derail greater aspirations. Even then, it must be made clear that in our individual capacity, there are very important roles we must play to actualize the dreams that inspired this journey. Prompt and regular payment of taxes and other statutory fees must remain at the top of our agenda, because when a government creates measurable levels of social prosperity, like we are currently doing, a share of the wealth created therefrom is also due to it, so as to further spread the fruits of development. The various health initiatives we are launching today, or we have just launched, will cost the state billions of naira to execute, so we encourage you to be steadfast in paying your taxes, because that is the fuel that keeps the wheels of development in constant motion. Abia, as we promised in our manifesto, shall be great in our lifetime. It is now in our hands to make that aspiration our reality. Distinguished ladies and gentlemen, let me also introduce one of our friends who joined us, who was not recognized by the MC. She was setting the protocol. Mr. Eustace Odunse is from Imeri, Imo State, and a good friend, a classmate in the university, my best man when I wedded 2 years ago. Ms. Governor, you're welcome. Distinguished ladies and gentlemen, let me thank you so much for being here today. Let me thank you for being part of the triple barrel celebration that we are having here today, and wish you joy blessings as you live here. God bless you. Protocol people, please be seated. Please be seated. Protocol people insist that they saved the flag of the sound intervention hearing mission for the last, saving the best for the last. And I wouldn't want to bother you, Baba, to come up here again. Rather, I'll call Dr. Laleko Makinde to join me as and then Bishop Sotono, please join me. Dr. Ekawa, please join. Eustace Hudson, please join. Honorable Commissioner for Health, please join. And all you, the leaders of the healthcare sector in the state, please join. Your Excellency, I insist you sit down, sir. I insist you sit down. All right, so handing this microphone over to Bishop Sunday and Hamon to conduct the rest of the presentation. Hello, Bishop. Your Excellency, the Governor of Abia State, Your Excellency, Baba, the Honorable Commissioner, the Chief of Staff, and all the members of the State Executive Council, the traditional rulers, I stand up in behalf of His Excellency to unveil and appreciate this wonderful program of our dear Governor in partnership with Baba Sound Intervention Hearing Mission 2025. And we declare it open in the name of God the Father, the Son, and the Holy Spirit.
Very much, Your Excellency. Please, a round of applause. A round of applause. A round of applause for our